Have you been concerned about your child's toe walking ever since they've been walking? Have you been told to just wait and see because your child will grow out of the toe walking despite seeing many therapists and specialists? Is your teenage child now complaining of hip pain, groin pain, knee pain, and foot pain because they're still walking on their toes? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you a case study of a young boy who we had met recently in our clinic. This young boy is now 14 years old, and he's come with his parents because he's experiencing groin pain, hip pain, knee pain, and foot pain. His parents have been concerned about him and the way he walks because he tends to walk on his toes. He has never been able to put his heel down on the ground right from the moment he started walking at 18 months old. Mom reports seeing lots of specialists and lots of therapists, and nobody could tell her why her child was unable to walk heel down, foot flat, and push off. Fast forward, he's now 14 years old. He plays sports. He is enjoying sports, but currently experiencing groin pain, hip pain, knee pain, and foot pain. So she was referred to come see us to get an opinion from us, as we are pediatric physiotherapists. On assessing this teenager, we found that actually he has increased muscle tone in his calf muscles, what we call spasticity. That actually limits his ability to put his heel down. And it is actually what we would call cerebral palsy. It is signals coming from the brains that's going to the muscle, causing increased tone and causing his foot to point down, and therefore he is on his toes. As a result of walking on his toes for the last 13 years, his foot bone has now come out where it shouldn't, and we are unfortunately unable to actually correct that foot bone now. What we can do for him moving forward is to actually do serial casting to stretch his calf muscles to allow that heel to touch the ground. We will be able to do radio shockwave therapy to reduce the spasticity in his calf muscles so that we can maintain that length as long as possible. Although with every growth spurt, he will probably need serial casting because the signals from the brain causes the muscle to actually always be tight. And we find that children with cerebral palsy, no matter how mild, well with each growth spurt, require some lengthening of their muscles using serial casting. So for this boy, we now know the cause for his toe walking. We are able to correct that with different strategies, and that should then prevent him having recurrent hip, groin, knee, and ankle pain whenever he plays sports. It is not uncommon to have children with very, very mild cerebral palsy where the only sign is toe walking on one foot or on 2 feet that seems to get missed whenever they see different specialists and therapists. So if you're out there and that sounds familiar to you, please reach out to us here at My Favourite Physio. Speak to one of our expert pediatric physiotherapists, because for experienced expert pediatric physiotherapists, these subtle signs are very clear, and then we can actually pick it out and instill early intervention for your child to prevent their foot bones from getting deformed by the way they walk on their toes. If you would like to speak to one of our pediatric physiotherapists, the number to ring here at My Favourite Physio is 02-9790-4233. And if you know somebody out there who's been frustrated looking at that child on their toes and just wondering what can they do about it, why don't you like and share this video with them? Until next time, have a brilliant day. Bye.